So this is a thank you so much to the organization committee and my dear friend Anila. It's a great honor to be here in Pakistan. And thank you so much for coming to listen to this talk. I just want to say that I'm very proud of you. And I met the leadership of the female neurosurgery team here in Pakistan. And it's a great work that you do. You're great examples to the new generation. I was so happy to see that there are very, too many, which is good, female neurosurgeons, young neurosurgeons here in the audience as well. Thank you so much. So we're going to change a little bit of a topic, and we're going to talk about something that nobody wants to talk about, actually. And I know a few months ago, it's my habit to go and look at the newspapers when I go to a new country. And a few months ago, you have the convention here with all the pediatricians and prominent figures coming together talking about the child development for 2035. And one of the goals is actually to make sure that the next generation gets the best treatment and the brain develops the most. But one of the things that we need to talk about when we talk about like our next generation is abusive head trauma, unfortunately. And that's what I'm going to do today. So I believe that every children needs like a safe home. And I think everyone believes. And why do we as neurosurgeons need to be involved in it? I think we're like leaders in our field in most of the countries, especially in underdeveloped and developing countries, not only in the developed world. Therefore, I think we have to be the voice for the children that we take care of as parents, as community leaders, as well as the physician leaders. Therefore, I think our involvement is essential. So as I said, I believe that we need safe home for children in every place, and every children counts. Does it work? Yeah, here we go. So my aim with this talk is actually to bring awareness. And I'm gonna say my take-home message at the very beginning. It's if you see something, say something and do something about it. And I wanna encourage you, all of you, to act on what you see, which is the most important thing. I want to say that the first case in the United States was in 1873, where an orphan children was abused by the adopted mother and was reported to the Society of Animal Prevention and Prevention for Animal Cruelty. It wasn't even a children's society, a society for the prevention of children, cruelty. Actually opened a year ago, was formed a year after that in 1874. It was the animals, not the children, that came first, unfortunately, at that time. When we talk about the child abuse, the WHO as well as the UNICEF defines child abuse in multiple ways. It's not only physical abuse, but also mental abuse, neglect or negligent treatment, exploitation and sexual abuse, as well as now, it's very important nowadays, abuse to the migrant immigrant children and children in conflicting zones. And the world is actually gonna celebrate the 30th anniversary of the Convention on the Rights of the Child on November 20th this year. And I think Pakistan has signed up to it 5 years later, about 25 years now that Pakistan signed that right. So terminology we use when we talk about child abuse is a little bit confusing, but when we talk about child maltreatment, it's the general term for injury to a child. And when we talk about shaken baby syndrome, where everyone uses that term very commonly, is actually a part of the, it's a mechanism of child injury. It's not the injury itself. And then the non-accidental injury or non-accidental trauma, per American Academy of Pediatrics, that was a statement published in 2009, is general term that is used for inflicting physical injury to a child. When we say abusive head trauma or non-accidental head injury, it only means the head injury to a child. So nobody knows the incidence. As we said, this is a topic that nobody wants to talk about, and therefore sometimes in most of the communities it's hushed, or it just stays in the family or the community. Nobody wants to go. So therefore, we do not know the real incidence of child abuse, but it varies certainly from community to community, the country to country, and region to region. But we know that violence can occur anywhere in homes, orphanages, refugee camps nowadays, prisons and schools, as well as in child care centers. The most affected group are the children under the age of 2 years. And we know that studies, when you do it, boys are more of a victim, more victims than the girls, but it again changes from region to region. When you look at the global, reports about more than 500 million children suffer violence every year, any kind of violence. The incidence in US is, a little bit better because we have a report that comes in every other years. 2017 and 2016 reports actually says that nearly about 700 children were victim of abuse or neglect. Head trauma is the leading cause of a death from an accident. It's actually more than the accidents. The head trauma from a child abuse case is more deadly. The number of children less than 5 years of age dying from an abuse is more than dying from an accident. And the young children under the 1 year of age is actually more prominent. We do not know the incidence in the countries, but we know the risk factors. And one of the biggest risk factors, low socioeconomic status. A single parent, a young parent, especially where there's teenage marriage, young marriage, is a risk factor. It is not ethnicity, it is not religion, it is not culture, but it's socioeconomic status. So in order to actually prevent child abuse, we have to look at the world in a bigger picture and then look at the socioeconomic, resources that we have. One thing that everyone knows, that a stressed parent with a crying baby is the main risk factor for a child abuse. And in most cases, father is the responsible person. Mother is 12.6% of the time is the responsible person. In US, mother's boyfriend is the, one of the responsible perpetrators, but it changes again from country to country. But we know that it's mostly an adult acquaintance of the child or the family is the perpetrator in most of the cases. Mechanism of the injury is multiple, but it's mostly shaking and impact, especially in head injury. So the presentation is very common, as all the head traumas, but one thing that needs to be, one thing that triggers us especially is the story. And we know that the best and the most helpful story history that you take at the emergency or at your clinic when you see these patients is the most helpful. That is the time that something has to trigger. And that is the time most of the suspicion of a child abuse comes. And when we look at our own data, that was the first time that somebody was worried about the history that is changing, that triggered our mechanism for child prevention. Presentation, as we said, is the same as the head trauma, but we know that a few things are more in non-accidental trauma than accidental trauma. Like seizures are more common presentation in non-accidental trauma. Subdural hematomas, especially mixed density subdural hematomas, posterior fossa or interhemispheric subdural hematoma is more common in non-accidental. Skull fracture, which is complex, involving more bones with intracranial injury, are more common radiographic findings. The other findings are important. If you don't have any CT or even a clinic, you only have an X-ray and ophthalmoscope and you're suspicious about a child abuse, then please take that ophthalmoscope and look at the eyes that you may recognize multiple retinal hemorrhages, which may trigger a child abuse, concern. Or a skeletal survey. If you have an X-ray machine, put that kid in an X-ray machine to look at old fractures. The radiation is not that high when compared to the risk of child abuse. The treatment, the rules of the treatments are very common, and depends on the severity, all the trauma patients. But prevention of secondary injuries, secondary insults in non-accidental trauma, such as hypoxia, seizures, are more important because they really go down fast. The outcome is good only 1/3 of the patients that are victims of the child abuse. The severe disability occurs in 5.5%, in some studies up to 30% of the patients. In some study, the rate of death was about 19%. But I want to talk about the economic cost, not the presentation, not the treatment that we all know about. The economic burden of a child victim for lifelong, who's survived a child abuse is very high. It's about $210,000 for one victim that survives a child abuse. And that includes like the medical bills, the legal problems, like, you know, the disability and the child welfare, criminal justice, like, you know, long-term care. And when you look at the total amount, you know, prevention is much cheaper, like we're going to talk about, but the total economic burden in US in 2008 was about 124 billion. When you calculate this, you can actually send 1.7 million children to higher education with that amount of money, which is heartbreaking to me, where we actually have children, about 20-25% of the children in the United States only goes to bed hungry every night. So prevention is more important, and prevention is much cheaper. In Western New York, they did a study and they looked at, like, you know, parent education. They provided the parents with some booklets. They were able to bring the cost by education about $10 per infant. So by $10 per infant, they can actually prevent the child abuse. Our numbers in Arkansas is the worst, you know, in the nation. I am very ashamed to say we had about 53 cases last year, about 5 of them died, and we're looking into prevention. But we do have a law. And then the act says we have to educate every parent that, you know, has a child born in the hospital. We have to provide them with educational material. We also do nursing home visits to high-risk families for prevention. But one thing that is important that I want to encourage is, if, as I said at the beginning, if you see something, say something and do something about it. It's very important that where you work, you know the law, you know how you can report these cases. And we report all these cases in Arkansas. Importance of reporting cannot be emphasized more, because most of these patients have sought medical care previously where we missed them. And the more commonly missed cases are where we expected the least. Then there's the consensus, you know, paper, which is a seminal paper that was published in 2018 about, like, you know, how to look at, you know, child abuse cases and how to differentiate it from normal. So let's look at the numbers in Pakistan. So where there's no official data exists in Pakistan about child abuse, and according to the unofficial reports from NGOs, non-governmental organizations, about 15-25% of the children are sexually abused in Pakistan. In Karachi, 88.7% of the school children reported physical abuse. So there are like seminal papers that Dr. Mehna, looked into it, 2018. So Pakistan is talking about child abuse, not only physical abuse, but all other kinds of abuse. But still, it lacks a definition of the child abuse. There is no mandatory reporting in Pakistan. I was looking at a hotline. I can only find one hotline that in the Punjab, province that you can call, but I did not find the national hotline. If you know it, please share it with your colleagues. So my take-home message is non-accidental trauma is something that we need to be more vocal about. If we suspect, if we see something we should be doing, something about, we should encourage our colleagues to do something about. It's much cheaper to prevent non-accidental trauma than treat non-accidental trauma. And the role of the pediatric healthcare professional, especially our neurosurgeons, sometimes are the first people to meet with these babies or children, is not to treat only, but also be advocates for the children. So if you see something, say something. Thank you so much.